A very good morning, a good afternoon, and a good evening, ladies and gentlemen. My returning subscribers, thank you so much. And if you are new, please subscribe, because Ask Prince is still bringing you the best research, science-based information for you to learn. Nsanyuse nnyo okubalaba nate mwebale kujja olunaku olw'olwaleero. Abankuumira oyo omutonzi w'eggulu n'ensi, mwebale komawo nate mwe abakadde abakomyewo okulaba video gye ntaddeyo. Naawe omupya nyiga ka subscription obeere nga buli lw'oteekayo video ogiraba. Ladies and gentlemen, today we're going to talk about signs of breast cancer. You who has been a member or a subscriber, remember we did a video some 2 months ago when we were talking about how to prevent breast cancer. Today we have come to talk about the signs, the symptoms you know that, oh, I failed to prevent breast cancer, now I could be having breast cancer. What are the signs you look at are the ones we're going to talk about today. Abe mikwano ngambye nti gw'omukadde ku page yange eno oba ku YouTube eno walaba video gye nateekayo nga njogera ku ngeri gy'osobola okwewalamu breast cancer, oba watogirabangako genda mu video zange ogenda kugiraba. Gw'omupya subscribinga ogenda kulaba zino videos. Kati bw'obanga olemeddwa okwewala breast cancer, biki by'olabirako n'omanya ti nandibanga nfunye breast cancer, bye tugenda okwogerako olunaku olw'olwaleero. Ladies and gentlemen, what is cancer? Cancer is just an abnormal growth. It can be in the bone, it can be in the chest, it can be in the lungs, it can be on the liver. Cancer can grow anywhere. For it, where it decides to grow, it's where it can grow. But today we're going to talk about that one that has grown in your breast. What are some of the signs you're going to look at? And straight away we go to number 1. Pain around the breast. Women sometimes get pain and tenderness. I mean tenderness or pain when they are going into their menses, or sometimes after their menses, sometimes when they are pregnant. But the pain when you have cancer of the breast is more severe. So therefore for it is marked and different. Mainly around the areola, or sometimes even when you touch the whole breast, it can be paining you. Abe mikwano ngambye nti sign oba kye tusooka okulabirako nti olabika olina breast cancer, ebbeere likuluma. Omukyala yenna aba agenda mu periods ebbeere limuluma. Sinakindi abamu bw'oba bakafuna olubuto obanga bavudde mu periods ebbeere libeera likuluma. Naye no pain gye twogerako ebeera nnyingi nnyo nnyini ddala nti oluusi ekulema n'okubeera nayo ne kikuwaliriza okudduka ogende okulaba omusawo, ye pain eyo gye twogerako. Point ey'okubiri, change in size and shape of the breast. When you have cancer of the breast, there is change in size of the breast. When you compare your two breasts, you find that the breast that is affected by cancer or cancerous cells, you find that it has grown more bigger, more larger than the other. So you can easily demarcate, you can easily know the normal and the abnormal breast. Abe mikwano ngambye nti sign oba ekirala kye tulabirako ekyokulabirako nti olabika olina cancer w'ebbeere, nti ebbeere lino ligejja, likyuka size, linza n'okweyongera okwanvu okusinga kuliri ebbeere eddala eddamu. And another sign or symptom we can talk about is darkening of the breast. Your breast darkens. If you are black, it totally becomes pure black. So we begin thinking of, I could be getting, or I could be having cancer of the breast. Abe mikwano ngambye sign endala y'okulabirako nti oyinza okuba olina cancer w'ebbeere, kwe kuddugala okw'ebbeere. Oyinza okubeera ng'oli muddugavu. Yes, nga buli omu akutenda okuba omuddugavu. Naye bw'ofuna cancer, naawe kennyini okiraba nti ate wano waddugala nnyo okusinga lino ebbeere eddala. Ensonga endala, the other sign and symptom is nipple discharge. That is not milk. All women, you know your nipples, right? You find that there's some discharge that is coming out that is not normal. Okay, it's not breast milk, you're not breastfeeding, but you find that discharge is coming out from your breast that is not normal. It means you could be having cancer. Run and see a doctor for a breast examination and nevertheless a scan. Abe mikwano ngambye bw'otandika okulaba ebbeere lyo nga lirina amazzi agavaamu gasimata, wabula nga galina abnormal, naye togategeera kikwe gavudde, wandibanga ofunye cancer w'ebbeere. Dduka olabe omusawo akebera ebbeere eryo, sinakindi akutume okole scan ogireete aginterpreting oba agiddemu amanye ekigenda mu maaso. Then the other sign is pulling in of the nipple or inverted nipple. You know, the nipple of a woman is supposed to be pointing forward. But if you're developing cancer of the breast, you find that instead of it pointing forward, it's now getting inverted, pointing inward. Meaning that the cancerous cells are pulling it inside out in order in future to create a hole or a wound. So if you're beginning to see your nipple, instead of pointing forward, is now beginning to point inward, it means cancer could be developing on your breast. Run as quick as possible to your doctor, to your gynecologist, to your surgeon to find out what is happening. Abemikwano ngambye ensonga endala nti ebbeere ly'omukyala likula lina kubanga lipointinga mu maaso bweriti. Ne bw'oba omaze okuzaala nga lyagwa era nipo yo oba ennywanto yo ebeera esonze mu maaso bweti. Ne bw'ogisanga etandise okutandika okusonga ng'edda munda bweti ekyuse kye tuyita mu lunyaanyimbe inverted, kitegeeza nti cancer cells ziri mu kula mu bbeere zigezaako okusika mu maaso eyo erireetera okubeera nga litunudde mu maaso bweriti ne litandika okubeera nga litunudde munda naddala ennywanto. Dukola b'omusawo wo akebere mwana wa maama wandibanga otandika okufuna cancer. Ensonga endala is redness of the breast. It could not be allergy, but you find that your breast is becoming red around the nipple, around the areola. It's all be turning into be red. If you're not red, as in red, you find it's becoming more red, you could be having cancer. Wampuliriza mu Luganda mpa ntegeeza nti ogenda okulaba ebbeere lyo likyuka litandika okufuuka kala red kyeki mu Luganda kale eya red nga bw'olaba omusa kangereze kale ku musaayi nga bwe lyagala okutandika okufaanana ne bubeera mweru wali olabyeko omweru gwe bakubye oluyi sikini ye nga bwefaanana ogenda okulaba nga naye ku bbeere lyo bwe wafaanana. The other sign is thickening and swelling of the breast. Ogenda okulaba nga ebbeere lyo liringa eritandise n'okukalubamuuko, lizimbye likalubyemuuko. Mwana wa maama wandibanga olina kansa, likolaba omusawo. Thickening and swelling of the breast, sometimes it could be mastitis, but this one is severe. You find that sometimes even there is hardening. You really touch and you feel that this breast is normal, but this one is soft and the other one is hard. Yes, you could be developing cancer. Run and see a doctor quickly to do a breast examination on you or a scan and find out where the problem could be. You could be having a cancerous breast. The other point we would like to talk about is you touching your breast and feel like there is a lump. You feel like there is something like a mass inside your breast. And this lump, just like we said, is hard. If you feel something in your breast, it is hard, it is not mobile, just stationed somewhere, you know, you could be having cancer developing. There are these normal lumps that women develop sometimes. They are movable. But this one is not movable, just stationed in one place. You could be having cancer. Run and see a doctor quickly. Abemikwano ngambye nti oyinza okudevelopingamu oba mubbeere mujjamu engeri y'akazimba nga kali mu kifo kimu nga ne bw'okakatako tekatambula ng'ate kakaluba, wandibanga ofunye kansa. Yanguwa bunnambiro laba omusawo akebere ebbeere lyo alabe kiki ekirimu. Nsanyuse nnyo okubawuliza n'olunaku olwaleero, munzikirize mbasiibule, omunyazi Mungu abankuumire atakuumira mpeera. Thank you ladies and gentlemen for watching me today yet again. Stay tuned for yet another video. Abemikwano, if you haven't subscribed, please subscribe. And my returning subscribers, I want to say thank you and God bless you. Have a blessed weekend. Bye-bye.